Hello, everyone. My name is Dylan, and today I, Audrey, and Kyle will be discussing exercise prescription for the obese and overweight adult population. We will begin with Audrey giving you general information about obesity and its causes, as well as material contained in our intake packet. We hope that by the end of this presentation, you will have a better understanding of the obese and overweight population and how to properly prescribe exercise for them.
Obesity affected about 93.3 million U.S. adults in 2015 to 2016, and 320 million people were classified as overweight. This means that 70% of our population is considered overweight or obese, and this compares to the 40% of the world population being considered overweight or obese. This means that we have the highest number of obese or overweight people for a country in the world. The prevalence of obesity for young adults was 37% aged 20 to 39. 42.8% was among middle-aged adults aged 40 to 59, and 41% was among older adults aged 60 and older. The BMI for obese people is considered 30 or above, and the BMI for overweight people is considered 25 to 29.9. Obesity is subdivided into three categories. Class 1 is a BMI of 30 to 35, 30 to 35 or less. Class 2 is a BMI of 35 to 40 or less. And Class 3 is a BMI of 40 or higher. There have been three main causes to be attributed to adult weight gain, which is behavior, environment, and disease and drugs. For behavior, poor eating habits and inactivity have been attributed. Poor eating habits include poor diet, a not very balanced diet, not getting enough whole food, vitamins, nutrients, and eating very highly processed foods such as fast foods and chips, candy, etc. And then the second in behavior is inactivity or sedentary behavior, where a person won't get up regularly, will sit a lot, won't do a lot of activity. The second is environment, and this could be a lack of sidewalks. They drive a lot because things aren't very accessible to them. They don't want to bike a lot. They have a very inactive job. They may have a sitting desk job where they have to sit for long hours of a day, and this can also increase sedentary behavior. And then the last is disease and drugs. Some diseases that can attribute to adult weight gain is Cushing's disease, which is your adrenal glands producing more cortisol, or polycystic ovary syndrome. And then some drugs could be steroids, and some antidepressants also cause weight gain. Obesity increases the risk of developing a number of potentially serious health problems, including coronary heart disease, high blood pressure, which is because the heart is working harder to get the blood to the adipose tissues, stroke, type 2 diabetes, because more fat in the blood leads to reduced insulin sensitivity, and some cancers such as breast cancer, colon cancer, endometrial cancer, gallbladder cancer, kidney cancer, and liver cancer. Obesity can also cause sleep apnea, high LDL cholesterol, and low HDL cholesterol, gallstones, osteoarthritis, and infertility or irregular periods. People with obesity may also experience an emotional toll, such as depression, feelings of social isolation or discrimination, and the feeling of having a lower quality of life. For our intake packet, we chose the forms informed consent, PAR-Q, lifestyle evaluation, and risk factors and signs and symptoms of disease. We chose the informed consent form so the client is aware of everything we are going to do and is not going to be doing anything that they don't want to or that is against their will. The Part Q form is the Physical Activity Readiness Questionnaire, and this allows the client and the trainer to see how fit or ready the client is for exercise and how much exercise history they have, and to see if they are aware of any health conditions that might prevent some exercises. The Lifestyle Evaluation and Risk Factors form is to see what their lifestyle is like now, what they want to remain the same, change, or improve on, and how they want the exercise to do that, and to see if they have any risk factors that are general, like injuries or diseases that could prevent workouts or certain exercises. And lastly, we chose the signs and symptoms of disease form to specifically look for cardiovascular disease risk factors and that can tell the client and the trainer if they need a physician's approval to do exercise and to see if their heart is ready for exercise. This is an example of a signs and symptoms form for cardiovascular disease. It shows all of the risk factors in the chart, and if a relative such as your mother, father, brother, or sister has a heart attack, for guys before the age of 55 and for girls before the age of 65, and they died from it, that means that you need to get a physician's approval. Or if you have chest pains or trouble breathing, you also need a physician's approval. But all the rest of these risk factors just indicate that you are on the track to have cardiovascular problems and that you need to keep a closer eye on your heart.
After the client has filled out their paperwork, you will want to do an interview to learn about their lifestyle and what factors have led to them being overweight or obese. You want to start with open-ended questions since it'll allow the client to give you information that they feel is necessary, as well as you not being too intrusive since you are learning a lot of personal information about someone in a very short amount of time. So some questions you can figure out are what types of physical activity they enjoy or did enjoy, how often and long do they engage in physical activity, and how long they want to be able to engage in physical activity. You can also figure out what time constraints they have to commit to exercise so that you can figure out what plan will fit best for them, since not all people will be able to exercise as much as ideally you would like them to. And then you can also figure out how they want you to help them, either through a lot of one-on-one interaction or just letting them work out on their own and checking in with them every so often, every weekly or bi-weekly, to figure out how they're progressing. And then you can also discuss with them their diet, but you can only give general recommendations that are published, and if they want more specific information about their diet, they will need to go see a dietitian to determine a personalized diet plan that will best fit their needs and help them achieve their goals. With overweight or obese populations, pre-exercise testing is often not needed since they start at a moderate to low intensity. However, the risk assessment forms you had them fill out before will determine whether they need medical clearance to work out at a moderate intensity, or if you can even progress them to a vigorous intensity later on in the program without more clearance from a doctor or any other medical professional. Since this population starts out with a low initial workload, the ACSM recommends starting them with no more than 2 to 3 METs with small increments of half to 1 MET increase in intensity over a week or so. You also need to make sure that the equipment that is in the gym is adequate to meet the weight specifications in the individual, and if you're taking measurements such as blood pressure, you need to make sure that the appropriate cuff size is used. Some testing that you could do that's not exercise related, however, is a skin fold test in order to get a more accurate idea of their body fat percentage that will be closer to what it actually is rather than a BMI test, which is not the most accurate way to determine a person's body fat percentage. The fit recommendations for individuals who are overweight or obese are as follows. For aerobic exercise, the ACSM recommends greater than 5 days a week of moderate to vigorous intensity as tolerated for 30 to 60 minutes a day, increasing both of those slowly and at a controlled rate. The type that they recommend is the usual aerobic activities such as walking, running, or swimming. However, with overweight and obese individuals, you do have to take into account that with the extra weight, non-load bearing exercises often feel better and they can do them for longer. With resistance training, the ACSM states that they should do 2 to 3 days a week at 60 to 70% of the 1 rep max to increase strength, mass, and muscle endurance. The type that's recommended is resistance machines and or free weights, and they should be doing exercises that work major muscle groups or multi-complex exercises. The recommendations for flexibility are the same as for all individuals, with it being more than 2 to 3 days a week with stretching to slight discomfort, and you're going to hold static stretches for 10 to 30 seconds with 2 to 4 repetitions after exercise, but they do recommend that they do static after exercise, dynamic before, and proprioceptive neuromuscular facilitation. With overweight or obese clients, there are some special considerations that need to be taken into account when setting goals for them. So you should target changing eating and exercise behaviors in general, as well as mitigating factors that cause them to be overweight, since this will result in long-term weight loss and maintenance, which is the goal, instead of having them yo-yo back and forth between losing weight and gaining it right back. So in order to do this, you should communicate with dietitians as well as their doctors and other healthcare professionals to see whether they've had any negative effects, whether you can increase their intensity if their risk factors have gone down, or if their heart health has improved, as well as other things such as injuries and any other sort of precautions that you need to take with them following their initial weight loss. Their goal setting should include short and long-term weight loss goals. For example, a reduction of 3 to 10% of the initial body weight over 3 to 6 months. If they are obese, you could have a long-term goal of getting down to a healthy BMI, but that could be a year or multi-year goal to do that in a safe and long-term effective way. Goals should also include things such as activities that they want to do that are not necessarily related to weight, so that even if their weight isn't going down as quickly as they want, they can see progress, such as being able to walk farther or be able to do stuff with their kids that they weren't before.
So now that you have a general knowledge of obesity and understand the ACSM's guide to prescribing exercise, it's time to apply this information to a possible scenario you might encounter at your job. Here we have Jen, a 42-year-old woman with health issues looking to improve her health. If you need to, pause the video now and read through Jen's information. As you're reading, keep a mental checklist of things that are important to know, such as medications and other variables. Now that you've read through Jen's information, do the things you deemed important match up with any in this list? It's okay if you didn't match with everything, but be sure to keep these things in mind when working with a real-life client. It's important to know what medications your client is on, as well as any current diseases or illnesses that they are dealing with. For example, Jen's depression will affect her motivation, which is an obstacle you will have to help her overcome. Since we now have a solid understanding of Jen, it's now time to begin prescribing exercise. Keeping in mind the ACSM's criteria and using the FIT principle, we can begin structuring a program tailored to Jen's unique situation. For our program, we decided that a 30 to 60-minute workout at low intensity 4 days a week using a 3 by 10 rep scheme with 2 to 3-minute rest would work best for Jen. While Jen mentioned she worked out years ago during her time in college, it is important to start slow due to her current situation. We don't want to start out too intense as to not discourage her if she feels like she can't complete the workout. Remember, along with Jen's hypertension and diabetes, she also suffers from depression, which affects her motivation. An example of a workout for Jen is presented here. We decided to split the program as upper and lower body. This allows for all major muscle groups to be worked while allowing adequate time for recovery. Jen will start with a warm-up and then begin machine and free weights work. The exercises listed are compound movements and use many muscles at once. They also alternate between front and back of the body to ensure that there are no muscle imbalances. Each day will end with a core exercise such as planks and then a 5-minute walk, finishing with static stretching to work on flexibility. Like the previous workout, Jen starts with a warm-up and then begins machine work. These workouts target all parts of the leg, utilizing compound movements as well as isolations. Jen ends with planks, and instead of her walking, we decided she should use the cycle ergometer. This is due to Jen working her lower body on these days, so we can reduce the impact and stress on her legs by using a bike instead of walking. Lastly, we end with static stretching to continue improving her flexibility. In summary, we decided to split the program as upper and lower body at a frequency of 4 days a week. This allows for all major muscle groups to be worked while allowing the recommended time of 2 days recovery. We also wanted to start on the lower end of intensity, even though it is recommended to do as much moderate to vigorous activity to encourage weight loss. This is due to her depression, so we have to change the way we initially start out. We also wanted to focus on activities that aren't too weight-bearing and could cause stress on her joints, which is why we chose things such as the cycle ergometer and using bands. Since Jen had worked out in the past, she is no stranger to lifting weights. Because of this, we decided that a mix of resistance and aerobic exercises would be ideal, especially since combining both has been shown to have significant health benefits in the obese population. While her aerobic exercises do not quite meet the recommended requirements of 30 minutes a day, 5 days a week, we are hoping that we can encourage her to walk more on her days off and/or eventually work our way towards doing more during her exercise days. So, before we end the presentation, we would like to go over briefly some of the things you've learned so far. Since most of the adult population is considered obese or overweight, the chances of you working with them in your field is very likely. It is important to consider what forms you need in order to gain as much information as possible about your client. Forms that look into health history and current health are a must, and asking open-ended questions during the client interview will give you everything you need to properly prescribe exercise. Remember that your advice isn't confined just to prescribing exercise. Especially with the obese population, it is important to also help change eating habits as well as reducing sedentary behavior. Things that could help achieve this are giving basic nutritional advice as well as communicating with other healthcare professionals. Setting goals are vital, and you must remember to set realistic, short, and long-term goals as described in slide 10. Lastly, when prescribing exercise for the obese population, make sure to start on the lower end of intensity. Congratulations, you made it to the end. Before you go, we would like for you to answer at least 2 of these questions regarding the case study. Let us know in the discussion board as well as any additional questions you may have for us. Thank you for watching our video, and we hope that you now have a better understanding of how to prescribe exercise for the obese and overweight adult population.